Be back to our program today. Each Thursday, of course, we have a chance to talk to one of the fine doctors from Kaiser Permanente, working right here in Orange County. Dr. Jeff Sodl is our guest today. He's with the Department of Orthopedic Surgery. Dr. Sodl, welcome to Channel 6.
Thanks very much.
A little bit about your background, where you went to school, and how you got into medicine.
Yeah, well, I'm born in the Philadelphia area. Sort of grew up there. Went to Notre Dame undergraduate in Indiana. Spent 4 years there. Moved back to Philadelphia for medical school, went to Temple University, then spent 5 years at the University of Pennsylvania doing my orthopedic residency. Came out to USC and did a year of shoulder and elbow fellowship, and then joined Kaiser right after that.
So specialization, specialization, specialization.
Yes, sir.
If I break my wrist, I don't see you. Only I have to break my elbow or my shoulder to see you.
That is correct.
Okay.
Yeah, we are a very subspecialized practice at Kaiser.
Right.
So we've basically got every body part covered with a subspecialist who's done extra training in that particular area.
Sounds great. Well, let's talk about the shoulder. A lot of people are, you see people doing this all the time.
Absolutely.
What are some of the common shoulder disorders that we get, especially as we age?
Especially as we age. Well, rotator cuff tears is one of the bigger ones that people always talk about. Certainly arthritis is another. Tendinitis or inflammation of the rotator cuff tendon is another. Stiff shoulders, or what we would call a frozen shoulder, is very common. And then also traumatic injuries like fractures. So those are probably the most common things that I see day to day.
We hear rotator cuff a lot of times with athletes, and those are certainly not elderly individuals, but they use those parts of their body a lot, especially if they're a pitcher.
That's right. Well, we see it through all spectrum of ages, especially athletes like you'd mentioned. It's more of a traumatic injury from overuse, throwing, or dislocations, instability, that type of thing. But as we get older, rotator cuff tears actually occur without trauma, and we would call that more of a degenerative tear just from the decreased blood supply to the rotator cuff.
Okay. Are those the major problems with shoulder pain, the things you mentioned?
Yes. Yeah,
okay.
I would say, through the course of a week, that's probably comprising 90 to 95% of what I see as shoulder pain.
Right. Well, we come in and it hurts. We don't know why, but it hurts.
Right.
How do you do a diagnosis on something like the shoulder, which obviously you can't see it from the outside?
Right, absolutely. Physical exam is really the best place to start. Assessing the range of motion of the joint, the strength in the rotator cuff, and then basic x-rays to make sure there isn't arthritis in the joint.
Okay. So you might see arthritis and deal with that, or
you would see arthritis,
a tear or some other problem.
That's right. So really, the combination of X-ray and physical exam can probably help narrow it down pretty closely for you. Weakness on exam would be a sign of rotator cuff tear.
Okay.
Decreased range of motion or stiffness would be a sign of a frozen shoulder or arthritis. And then the X-rays can kind of help point you in the direction to pursue a little more closely.
If it's both shoulders, would it more likely be something like arthritis? If it's just one shoulder, more likely a tear or an injury?
I don't think it's any more likely. Certainly if there's an inflammatory arthritic condition like rheumatoid arthritis, that could be more common to involve both sides. Usually osteoarthritis, or the typical wear and tear arthritis, is one joint over the other.
Does it depend if you're right or left-handed?
Not so much.
Really?
Not so much. You would think that,
that
more commonly
use your right arm more, it would wear out faster or something.
Yeah, in laborers, you'll sometimes see it more commonly in the dominant extremity, but not always.
Okay, treatment. I guess first you have to find out what it is, and then you decide how to treat it.
Exactly. Yeah. Oftentimes, for the shoulder, treatment is conservative, especially as patients get older. We can get them much more comfortable with anti-inflammatory medications, sometimes cortisone injections, ice and physical therapy, and then prevention, of course, is the key. Decreasing the risk for falls and things like that.
The old joke, doctor, when I do this, it hurts. Doctor says, well, don't do this. Yeah. And sometimes that's doable, but certain things, if you want to keep playing golf or tennis or pick up your grandkids, you need to use those shoulders to do that.
Yeah, sometimes you need a period of rest and a period of avoiding those activities until you can kind of build yourself back up to get back to doing all the things you like to do.
Not that we're trying to put you out of business, but how can we prevent some of these injuries?
I think one of the keys, like Ed mentioned, is staying active, staying healthy, and preventing things like falls, which can oftentimes be a cause of fractures or rotator cuff tears.
I understand that's one of the biggest reasons people end up in emergency rooms is heart attacks and strokes somewhat, but falls to a large extent.
Absolutely, and it keeps my other partners busy with hip fractures and other injuries of that sort.
Well, it's bad when it happens, but it sounds like there's lots of good treatment options available out there.
I think so.
You start out with the more conservative ones, and then as necessary, possibly even surgery.
That's right, and sometimes it'll take advanced imaging studies like MRI or CAT scan to really make the diagnosis and hone in on what exactly you're treating. But then from there, we have a lot of great treatment options.
Good. That's always reassuring to know there's things they can do to help us out there. Dr. Sodl over there at Kaiser Permanente, and he works out of here in Orange County and does some of your surgeries right down here at the Irvine Hospital.
That's right.
So right nearby.
That's right.
Thank you for joining us. Good to have you on the program today.
My pleasure. Thank you.
Dr. Jeff Sodl, who is with the Orthopedic Surgery Department at Kaiser. And again, if you'd like to find out more about Kaiser and the services they provide right here in Orange County, there's the number on your screen, 932-2052. That's Kaiser Permanente, and of course that nice new facility right up the road from us in Irvine. We'll be back with more right after this brief timeout.